Thank you so much for being with us this morning.
Thank you, appreciate it.
Explain first of all what you're seeing right now. What are you seeing in your patients?
So we're seeing a lot of allergy symptoms this year. It's been a pretty rough season so far. So a lot of watery eyes, watery nose, itchy, sneezy, congestion, a lot of that.
What do you believe is the greatest cause right now? What kinds of things are people most allergic to?
So really it's all the pollen in the air.
Okay.
So the trees, the flowers, the grasses, and with the wetter winter that we had, I think we're seeing more of that and at different times than normal that's making more symptoms.
Yeah. Explain for people too the difference. You know, there's a lot of time confusion between a sinus infection or perhaps allergies. How can people know the difference?
Right. So there is a lot of overlap, and a lot of time people have similar symptoms. Sinus infections are bacterial, and so you may have more pain, you may have fevers, more thick drainage from the nose, as opposed to the allergy symptoms that are, again, environmental things. But a lot of people have both, and it can be hard to tell the difference.
When is it important for people to go to a doctor?
So I think try the simple things first, and if that's not working, go in. Or if you have just really severe symptoms, go ahead and call your primary, get looked at.
Yeah. And what kinds of treatment would people should expect when they do go to the doctor?
Right. So we start with simple things like nasal steroids, nasal saline rinses, antihistamines. And if those aren't working, we do have some more aggressive options. And certainly for infections, we think about things like antibiotics or steroids to help reduce inflammation.
Do you think things will get worse?
Hard to say.
I know, you don't have a crystal ball.
But no, I think we're through a lot of the early allergy season, thankfully. But we're not over yet, and I think there's a lot of time left.
Is there some kind of prevention that people can use or should be doing if they typically suffer with allergies?
Right, so I think the big thing we think about is avoidance. So if you know that you're allergic to certain things, do your best to avoid those things, which is easier said than done. You can't avoid everything. The other thing is, if you are someone with really bad allergies, think about allergy testing so that you know what you're allergic to and can help to kind of tailor things better.
That is a lot of great information. Thank you very much for joining us this morning.
Thank you so much.
All right, Mike, back over to you.
All right, thanks so much.